How can I understand my reproductive cancer screening results? Understanding your reproductive cancer screening results can feel overwhelming, but knowing what the tests look for and what the results mean is key to staying informed. Screening tests are designed to catch early signs of cancer or precancerous changes before symptoms appear. For cervical cancer, common tests include the Pap test, which looks for abnormal cervical cells, and the human papillomavirus test, which detects high-risk types of the virus that can cause cervical cancer. Sometimes, both tests are done together, called co-testing. For testicular cancer, screening is less routine and usually involves a physical exam to check for lumps or abnormalities. If something suspicious is found, ultrasound imaging and blood tests for tumor markers may be used to evaluate further. When your results come back, they can be either negative or abnormal. A negative result means no signs of cancer or precancerous changes were found, and your healthcare provider will typically recommend routine screening at the regular interval. An abnormal or positive result indicates there may be changes or risk factors present, but it does not mean you have cancer. For example, a positive human papillomavirus test suggests high-risk virus types are present, which could lead to cell changes if left untreated. This often prompts follow-up steps like repeat testing, closer monitoring, or a procedure called colposcopy, where a doctor examines your cervix more closely. If your Pap test shows mild cell changes, these often resolve on their own, but more severe changes might need treatment to prevent progression. It's important to understand that an abnormal result does not automatically mean cancer. It usually points to infections like HPV or early cell changes that can be managed effectively. Sometimes, infections can reactivate after years of being undetectable, which doesn't necessarily mean increased cancer risk but still requires medical attention. False positives can happen, especially in younger women, meaning the test suggests a problem when there isn't one. That's why follow-up testing is essential before any treatment decisions are made. For testicular cancer, screening is typically done if you notice symptoms like lumps, swelling, or pain, or if you have risk factors. Physical exams and ultrasound imaging are the main tools used. If abnormalities are detected, further tests like blood markers or biopsies may be needed. Early detection is crucial because testicular cancer is highly treatable when caught early, so being aware of changes and seeking medical advice promptly can make a big difference. After your screening, follow your healthcare provider's recommendations carefully. This might mean repeating tests after a certain period, undergoing more detailed examinations, or starting treatment if necessary. Staying consistent with your screening schedule helps catch issues early and prevents progression. If you have questions or concerns, don't hesitate to discuss them with your doctor, who can explain your results in the context of your personal health history and risk factors. Remember that screening guidelines can vary based on age, medical history, and other factors. For cervical cancer, screening usually begins at age 21 and continues through age 65, with intervals depending on the type of test and previous results. Vaccination against human papillomavirus is also a powerful preventive measure, reducing the risk of high-risk infections that can lead to cervical cancer. Always seek advice from qualified healthcare professionals for personalized guidance. In summary, understanding your reproductive cancer screening results involves recognizing that abnormal or positive findings often indicate increased risk or early changes rather than cancer itself. These results help your healthcare team decide on the best next steps, whether that's monitoring, further testing, or treatment. Regular screening and open communication with your healthcare provider are essential for early detection and prevention, giving you the best chance to stay healthy.